Hi there. I'm Dr. Sam Hazledine, founder of MedWorld, and today I'm interviewing Dr. Johanna Ward. Jo's had a rather unconventional career, hasn't taken the usual path, so she's going to be interesting to talk to. For a while, she ran a skin and laser clinic in the UK. Then she sold that up and set up her own business. So we'll explore that because I think doctors moving into business, it's something that doctors often ask about and are interested in, but it's not. They're not always sure how to do it. She also has an interest in preventative medicine, which I think will be interesting to explore because, as we know, over 50% of doctors are in burnout. And so that preventative approach has got to add a lot of value. And then just to top it off, she recently contracted COVID-19. So I haven't actually spoken to anyone who had coronavirus. So I think that will be interesting too. So welcome, Jo.
Hello, thank you for having me.
Absolute pleasure. Look, let's start with the most topical piece with the COVID-19. How did you contract that? I mean, okay, to put some context, you're in the UK, I'm in New Zealand. So so people can understand that. That's why it's dark here and light there. But how did you contract the coronavirus and how was that?
Well, to be honest, I don't know how I contracted it. Maybe through a patient, maybe through work, maybe through the children's school. I really don't know. I became really unwell in early March, which was before our lockdown here. So it was a couple of months ago now, but I was very poorly indeed. I'd actually contracted tuberculosis when I was a young medic. So I have a slight kind of comorbidity or dispensity for it. But yes, I spent 17 days in isolation, very breathless, very high fever, feeling incredibly unwell and very anxious and worried about whether I would survive or not, if I'm honest.
Wow. So, I mean, it's, for those of us who haven't experienced it, it's all out there. It's on the news, here in Queenstown, New Zealand. I haven't, seen anyone or seen anyone who's been, badly affected by it. So very real for you then.
Yeah, absolutely. And I think one of the things we have to remember as medics is that this can happen sometimes. It's now my second disease that I've experienced in the line of duty. TB, the first one as a younger medic, and now COVID. And here in the UK, lots of healthcare professionals have contracted COVID. In fact, We've had a bit of a disastrous time with COVID.
Yeah, you have. I mean, it is a reality, isn't it? And I think as young, when we're younger people getting into the profession, we it just doesn't even cross our minds that that's an issue. But that's, I guess, a reality of doctors, and even not just the younger doctors. As you get older, it's very much in the psyche of doctors, isn't it, that they don't prioritize themselves.
That's right. We're taught that we are here to serve our community, and we are.
Absolutely.
But with that, we take risks on a personal level. We sacrifice an awful lot of family life and personal time, both in the pursuit and study of medicine and then the practice of. And these sometimes aren't things you consider when you're an 18, 19, 20-year-old thinking about going into med school.
No, that's right. It just occurred, that same mentality that causes us not to think about contracting COVID is the same mentality that's probably driving, or contributing anyway, a lot to the burnout crisis that we see in the profession at the moment.
Yeah, well, we have the same problem here with burnout. Medic burnout, corporate burnout, personal. I think we're all living incredibly kind of cortisol driven 24/7 lifestyles. We're all juggling an awful lot of things. We seem to have more things to do in less time these days. We have the wonders of technology, but with that comes some of the negatives too. And it just seems like we're cramming so much into life that sometimes we're forgetting to live.
Yeah.
And I think the burnout issue is a big problem, because I always call stress the great saboteur. It affects your health, your mental health, your physical health. It can mean that you don't enjoy your life, and you're not getting quality out of your life, which would be disastrous, really.
I mean, we focus on the doctors, and they contribute so much, but as you say, it is disastrous for them not to feel that, I guess, that zest for life. So let's stay on there. I mean, why do you think that burnout is so prevalent right now, that it's worse than it's ever been in the medical profession?
Well, I can only speak from having worked in the English system, because I've not worked in any other system as a doctor. But in England, we have the NHS, and most doctors practice in the NHS. And within that, we have seen over the years a gradual stripping away of funding, resources becoming more scarce, morale is lowering all the time, people are feeling less supported. There's more of a divide between management and clinical staff. And a big crisis like this, the COVID crisis, has really put NHS workers at the forefront. They've been absolutely exhausted, and all the pressure's been on them again. So some NHS workers have been separated from their families to keep them safe while they're in ITU and on the front line. So, I mean, burnout's a big problem, and we need more investment. We need more support, I guess. We need, certainly in England, we need more doctors and nurses and healthcare workers. We're having a decline in numbers, which is worrying. But we'll never be able to recruit great people if morale is low, and if people don't feel that the sacrifice you make is worth it at the end of the day. There are many more lucrative ways to earn a living. We all know that. Nobody goes into medicine for the cash or the money. You've got to want to help people and to be an ambassador for health and wellness.
Yeah, I mean, you speak to a systemic failure, and I would agree entirely. You don't have a workforce where 50% are burnt out and say, the problem is the individual. There was a bit of a phase there where people were talking about resilience in doctors. My personal belief is that there are very few people who are more resilient than doctors, and more resilience is required as a symptom, not a cause. And I'd agree, it's systemic, but given, even though it is a systemic failure of a system that puts increasing stresses on the workforce, I guess for individual doctors, if they just say, okay, it's just the system, then that's almost saying there's nothing they can do about it. For an individual, with what you've learned and practiced in preventative medicine, in your experience, what do you think some of the top things that, or some of the most effective things doctors could do to actually prevent burnout in themselves within a system that's broken?
Yeah, it's broken, but it can be fixed, definitely. I always talk to my patients about stress management. So, I think just simple things like incorporating some meditation into your life is so effective. Things like Pilates and yoga, when I started practicing them, they really opened me up to a new way of managing my own stress. And then things like exercise. Exercise is wonderful therapy. So the very things that we're telling our patients to do to make themselves feel better, to bring down their risk of chronic disease, to eat great, nourishing foods, to look after yourself, to manage your stress, to get yourself out regularly for exercise. Sometimes they're the things that when we're busy as doctors, we don't find time to do. And I do think that if you create and find the time to do these things and live a healthy, fulfilled life yourself, it all has a domino effect. And sometimes then you find yourself re-engaging with your practice again and loving your profession again, because you realize a new way that you can help people.
You know, I think the hopeful thing that I find with this, we're in a situation where it's pretty tough on a lot of doctors, is that, you know, when you speak to experts, the answer is actually really simple, and it's the fundamentals. You know, to just watch that Michael Jordan documentary on Netflix, and you know what made him such a great player. I mean, other than the competitive drive, was the fact that he spent time on the fundamentals. You know, he'd spend longer doing free throws than other players, and he just became better at the fundamentals. And it seems like that. I mean, that's the thing with doctors and burnout, isn't it? It's the fundamentals that when they drop, and it's easy to see why they drop. You know, when you're tired, when you just haven't got the energy, because you've been doing multiple long days or whatever it is. But when you take care of those fundamentals, it's amazing how the rest actually can follow. The burnout's more is a symptom, not a cause.
Yeah, and sometimes, you know, we have to be as individuals thrown into a crisis moment to reflect, make changes, and progress forwards. You know.
It's interesting, isn't it? Just thinking about my sort of journey with burnout and coming out and things, and I guess if you think about those areas, our research, one of our pieces of research we did kind of found that of decent decent interventions or practices, each one might work with, particularly effective with, say, 10 to 15% of doctors. And the problem comes with going, which one is it that I'm going to actually use, and which is one that's going to change it for me? And my experience was actually sometimes you don't know, and you just have to kind of address different ones and get to a point where you go, that turned out to be the difference that made the difference. It might be diet, it might be exercise. For me, the bit that really helped was quietening the mind. And I did all this work around physical health and fitness and sleep and things, but actually quietening the mind was the thing that helped the most. But maybe it was because the other things had been addressed already.
Yeah, absolutely. And I do think that as doctors we should practice what we preach. I'm totally devoted to health and wellness. I've written books about it, and I live and breathe it. But some doctors don't, and I think we should teach our patients by example. We should be an inspiration to our patients. They should want to come and see us because we love what we do.
The funny thing about that, so I was doing a whole bunch of research into doctor stress and burnout, and this is a few years ago, and I was working pretty hard on it, and I was getting a bit tired, a bit run down, and I just thought I was working hard, young children, all this sort of stuff.
Yeah.
And I'm essentially I'm an expert in that sort of doctor stress and burnout. And one day I was like, maybe I'll just do one of those tests, the burnout test. And I did the test, and I was completely burned out myself. And I think for me, that showed me how the mentality of doctors is that we look out, we don't look in, and it's always in someone else. And I think that the stats show that over 50% of doctors are in burnout, but 1 in 2 doctors wouldn't acknowledge that. And so I think part of the moving forward and healing is acknowledging that there might be a problem. And I would suggest that for doctors, if they have an inkling that there might be a problem, then follow that inkling, because for me, my experience was, even though I was fully immersed in the field, I missed it in myself.
Yeah, easily done.
Yeah.
Because also we're kind of taught to have a professional facade that is in control and knowledgeable, and people come to see you for help, not the other way round. So yeah, I can understand why some doctors find it hard to say, look, one, maybe I'm not enjoying this. What should I do? Where do I get help? Who do I talk to? Because it is difficult. And sometimes it's hard for doctors to go to their own doctor because they're known as, colleagues or doctors and things. So sometimes it can be difficult for us to get help.
Yeah, we do like to project that we're bulletproof, don't we?
Exactly. Yeah.
So Joe, sort of shifting gears a little bit. When we've talked about this burnout and the challenges in medicine. You think going back to when you were younger and becoming a doctor, like what were your expectations going into the profession, and what would you say what are the biggest surprises you've had as you progressed?
Yeah, well, actually, if you asked me back then what I would end up doing, I wanted to be a plastic surgeon. That was always my dream. My dad's a surgeon, so I obviously got some inspiration from there. And I just loved doing procedures. But the problem for me was that I have 3 young children, and it became very difficult to juggle hospital life, on-calls, family life. And then I developed an interest in dermatology, loved that. And then I moved sideways. And actually one day I just decided that I was going to give myself 2 years. I was going to set up a business because I suddenly thought, I think I know what I want to do. And I think I found my calling. And all my friends and family said, you're crazy. Don't leave a guaranteed job in the NHS. You've got an NHS job for life, really, in England normally. But I didn't listen to any of them. I knew in my heart that maybe I was destined for something different and I wanted to give it a go, and I did. So I went to the bank and tried to get a loan to open my first business. They wouldn't lend me any money. And so I sold my car and set up my very first practice. And it was a 2-room, it was the very first part of what became a very large skin and laser clinic. That then 8 years later I sold. So that was my first experience of business and being both a clinician and an entrepreneur.
And how did you find that transition? And what surprised you? What did you have to learn, and I guess how did you have to grow from a mindset perspective to take that transition from doctor into entrepreneur?
Yeah. Well, first and foremost, I'm always a clinician. You always are. That never changes. And I was working in kind of dermatology and private dermatology and laser. So I was treating lots of acne, rosacea, acne scarring. So it was still a clinical job. But over a couple of years, I suddenly had 12 employees. I had huge overheads with lots of different lasers on finance and things. But actually, I loved it. I'm self-taught in business. You can attend conferences, and there's so many amazing business lectures online and things like that. So I did all of that and I soaked it up. I loved it. And the freedom that's come with, for me, working for myself and setting up my own business has just been phenomenal. It's been an unconventional medical career, but I do still practice 2 to 3 days a week. So I've kind of gone full circle because I sold that first business and then I started a second one, which is my skincare and nutritional range. So slightly different again, but still as a clinician developing formulas and things like that, which has been amazing. But the journey's been like this, a lot of learning on my feet. But the most important thing is for my team is there's no hierarchy. I surround myself by positive, passionate people. They inspire me, I inspire them, and it's all about the team. It has to be in business. It's all about the team.
Yeah, well, that's it, isn't it? Interesting just listening to you, and I'm just reflecting on the doctors I know who are in business and who are doing well, and the doctors I know who are in business and aren't doing so well. And to me, a commonality amongst the doctors who are thriving, they love it, the business side. And so they immerse themselves in educating themselves in business. I'm the same as you. Didn't have any training before I set up MedRecruit, or then Med Capital, Med World. But I was so interested in it that I just threw myself into learning about marketing, learning about sales, learning about finance, operations, all that stuff. I lapped it up, and it's like you went to conferences and read books and listened to CDs back then. But just loved it, and I think that's actually just interestingly, because I know doctors sometimes have a reputation of not being great in business, but it's probably because because they're capable of it. It's probably because they're not actually super interested in it. Would you say?
Maybe. I mean, I always think that anyone that's passionate about anything gets further than someone who's half-hearted. That's just life, isn't it? We love people who are passionate, driven, they excite you. And if you're in a business that's got to make sales and is, has a product that needs to be sold, if you don't believe in it, no one else is going to. So I think there's a really kind of contagious energy about things. And I mean, I started my skincare range 4 or 5 years ago now. It's now in Harrods, Selfridges. I never could have dreamed that would happen. But to be fair to me, I've taken risks. I was willing to sacrifice a lot of time. You and I know that when you leave a job that's paid and you start your own business, you often leave, 40 hours of work and gain 80 hours of work commitments a week in the beginning. So, there's been an incredible personal sacrifice for most people who have set up businesses from scratch. So, you have to commend them. It's not an easy thing to do, and there's always risk.
Interesting point you made there around the passion around it, and I think that's probably even more so important for doctors. Like, doctors, as you say at the start, as you said earlier on, we don't get into medicine for the money. We get into it because we want to make a difference in people's lives. And another point you said there is you're always a physician first, and while I don't practice anymore, I absolutely consider I'm still a doctor. And once you're a doctor, you're always a doctor. And I think that passion piece, or that is doubly important for doctors compared to not to sort of other people in business. I look at the work we're doing with Med World and how that then wraps in MedRecruit, Med Capital, and for me that's kind of life work. It's like how do we help shift the culture of medicine so that all doctors are well, because well doctors practice better medicine. And so I guess if you sort of thinking about it as a doctor who's thinking about getting into business, I think a really important part is to find what is that drive, what is that passion that means that this is something more for you than just another way of earning a crust.
Yeah. And the hard thing for some doctors is they'll realize that they're not fulfilled in medicine and that they may need to do something else to open up a career for them that they do love, because we all know there's nothing worse than clock watching in a job.
Yep.
Every single day that I work in my job, whether it's in the business or seeing patients, it's never a chore. I love it.
Yeah.
Every single day I wake up and I think, yay, it's work.
Yeah.
And I realize I'm very blessed to be able to live that way. I am a passionate advocate for health and wellness. The first book I wrote was about our food choices and how they impact our long-term health and chronic disease. And, I live and breathe health. And I think my patients come to me because they know that. And I think it's really important, like you, that we create a workforce of well, happy, inspired, motivated doctors, because I want to go and see a doctor that's motivating me to, exercise and eat well and, manage my stress and sleep well. And, we should be the ambassadors. We should be leading the way. And if we're not as individuals fulfilled in our careers in medicine, there are ways of moving sideways. There are ways of doing consultancy posts and things like that. And, I think we've got to think outside the box. Once you're in that career, if you're unhappy, It's difficult, obviously. You've got to be honest with yourself. But there are other career options out there.
Mm. Yeah, absolutely. And I think that's the hope piece. You know, I agree with you. If you're not loving what you do, and it may be because you're burnt out, so there's address that first. But if it's because the fundamentals of the role, you know, you've got a long life ahead. It's a long career. And I, you know, what I love about, say, what I do is that I absolutely still feel, you know, connected to the medical profession. It's like my patients are doctors now rather than patients. But I 100% feel like I'm still, but there's still a way to be in the medical profession, with as you say, with a sidestep. And that was one of the reasons with MedRecruit at the start that I set it up, because I just, back then I didn't sort of articulate it with well doctors practice better medicine, but I saw so many of my classmates disillusioned, so many people leaving the profession soon after graduation. And I just hallucinated that, well, if you could create essentially a locum agency so they could have some fun, live at the beach, make some money. And the key part as well was try out a few different specialties and sort of depressurize, just give it a go. And that people would find the thing they love, because it may not even be a sidestep out of medicine. That was my theory back then. It was like, it might be, just a gear shift within the profession. Find what you love. Find the consultants that you enjoy working with, and then re-engage. And I just, back then I looked at it and said, for a doctor, taking 2 to 3 years to actually enjoy yourself and find what you want to do for the rest of your life is a good time investment, as opposed to just getting on that ladder. Because I think that's one of the things we get caught up in as doctors, is because it is so hierarchical, it is very, very easy to compare yourself, and you compare yourself with your classmates. So it's very easy to go, oh, I see Nick's, got onto the specialty training program, and I'm a year behind. So you start to compare yourself with where someone else is at, as opposed to running your own race. And I think, for me personally, I think that's a really important part for doctors, is to run their own race, rather than just get into the climbing the ladder.
100% agree.
So Joe, sorry, carry on.
No, it's fine.
So, I mean, you have a bunch going on. You have 3 children. You practice medicine. You have a business, a significant business. How do you, when I reached out for this interview, responded immediately. We set it up. There was no problem. How do you achieve a lot? How do you make it happen?
Well, over the years, I've learned to be boundaried about what work is and what family is. So weekends are mine. I try to limit my international travel. My kids are just that bit older now, so they need me around to help guide them. And I figure that's my most important job in life, is to be there for my children right now. So when they're at school, I work. I have an amazing team that fill in the gaps and do all of the admin. And then when my family are at home, that's their time, and I'm engaged with them. And that's been one of the most critical things for me to learn, because it's a skill, is to fully engage with people, when they're there, your family, your kids, and not be half working. Yes, kids, because it's very easy to be glancing at your phone and doing this and doing that. And my kids will call me out if I do that. They'll say, "Mummy, you're clearly doing something, put that down." So I have my work time, I have my family time, and a great team. And then there are just some things that come up that, like you reaching out, that just look fun.
Yeah.
And especially to talk to a medical audience, because I know that when I meet other medics, they always say to me, "Oh my gosh, your story's amazing. You've been so brave," or "You've taken so many risks." And, they're interested in how you can have an alternative career, how you can create a brand, how you can have a skincare company, a nutritional company. It's just different. So, and I can see that it's different to what most people that I went to med school with. And so I think it's nice to share that journey the highs, the lows. It's not been easy. And to keep it real, and to maybe inspire someone out there that might be listening, you know, that there are other things that you can do, you know, or there are ways of making what you're currently doing feel more inspired and happy.
Yeah, absolutely. You talk about it being a skill, you know, that you learned to be able to, you know, shift gears when you're at home. I was interviewing Dr. Fiona Wood, who's like Australian of the Year. She pioneered spray-on skin. And something that has always stuck with me that she said is, say something of the best of you for those who mean the most to you. Yeah. How have you learned that skill? How have you learned to shift gears and show up as mum, and, you know, show up as Dr. Ward? You know, how have you learned to shift gears when you need to?
Okay, so there was a moment when I had my last business, the skin and laser clinic. It became enormous, very successful, but it took all of my time. And my children noticed it. You know, they were always like, "Mummy, you're always working." And you know, husband noticed it. You know, it really took over my life. And when they all reached out to me and said, you know, look, the business is doing great, but we've kind of lost you, I had to do some really hard reflecting, because I was like, oh, but the business is doing so well. But actually, you know, family comes first. And I realized that I had drifted away from my focus on my family and become, you know, really consumed by work, and a workaholic in many ways. And so for me, what I did then was I started looking for a buyer. I knew that the time had come, that needed to go. I needed to be back with the family. So I actually sold that business and took 2 years out, wrote my first book, and was there doing school drops, school pickups, off work for 15 weeks a year with the kids on their summer holidays. Mummy was back. And that was really important. But I was very lucky to be able to have that time off. So I have been caught out myself by working too much, because I love my work. It's easy to become very consumed by it.
Yeah.
But yeah, you know, family comes first, and quality time with your family you'll never get back.
I mean, it comes down to I mean, what you're saying there, I mean, it's about prioritization, isn't it?
Yeah.
And not
sometimes.
So carry on.
Sometimes you have hard decisions to make.
Yeah, but if it's truly a priority, then you make it happen, don't you? You can make it happen. Yeah, I mean, what would you say to a doctor who you know, because I know a lot of doctors who would sort of, there's often a yeah but, you know, around looking after themselves or prioritizing their families, even when they want to. There's something that it almost prevents them. And, you know, that's, you know, part of that work I did around getting the World Medical Association to include the health and well-being of doctors in the Declaration of Geneva. The modern day Hippocratic Oath was around, you know, there was nothing in there around doctors and themselves. And doctors, you know, not all, but a lot of doctors seem to really struggle with actually putting themselves or their families first. What would you say to a doctor who's having that struggle, who wants to?
Well, it's difficult because we are driven by a duty of care. We're here to provide care for our communities. And I mean, look at what's happened with COVID crisis. That's really, you know, put doctors at the forefront. You know, people can't take time off. They're not even living with their families right now, some of them here in the UK, because it's just too risky going backwards and forwards from hospital back into the home. Some people have been separated from their children for 9, 10, 11, 12 weeks. So this is that whole duty of care, isn't it? Is that we have incredible obligations, and you know, most doctors are really great people, and they've answered that humanitarian calling, and they will put patients and community and people first. So it's difficult. I think most doctors aren't particularly selfish, and they, like you say, they don't prioritize themselves, or even worse, maybe if they wanted to, we make them feel guilty. You know, so I know as a mum, one of the hardest balances has been, you know, getting that nice balance between work life and family life, and not feeling guilty when I'm not there for one or the other. It's very difficult.
I mean, it feels like, I mean, it's that age old sort of urgent and important. And the problem, I think, you know, for so many doctors is everything is urgent. You know, the staffing needs a doctor. We haven't got anyone to work the long day, or, you know, this patient needs you, or, you know, whatever it is. There's always something. And that's the challenge where, you know, if you sacrifice the important long enough, it really starts to suffer. And I was talking to someone the other day actually about this, who's very, very giving, you know, really giving to the detriment, very generous to the detriment of himself and his partner. And the thing that shifted it for him was when I said to him, you know, your giving and contribution, if you just take a short-term view, you'll always give to who you have there. But right now, you're sacrificing your long-term, you know, happiness and relationship with your partner, who you really care about, because of that. And just shifting to a longer-term view, you know, help them to make a shift.
Yeah, it's, you know, I think, like you said, we're not here for a long time. It's important that we enjoy what we do, that we have a happy, fulfilled life in relationships. And I mean, I know lots of relationships that have really suffered because doctors have been at work, on call, can't escape, always late, always ruminating over, you know, did I make the right decision? You know, because we take a lot of our worries about our patients home with us as well, don't we? And if you have a partner that doesn't really want to listen to all of that, you end up internalizing an awful lot of suppressed stress and anxiety from work that can then kind of, you know, eat you up as well. So I mean, I think finding a supportive and understanding partner is one of the most important things that you can luck out on, really. Because someone's going to have to understand that we do have that duty of care, and that we all want to go over and above, and we'll always say yes to that 1 or 2 extra patients on the list, just in case, you know, they're the one that might be having the MI, or they're the one that might be, you know, having huge mental health problems, and today was the crisis point.
So interestingly, this sort of makes me think there's very much a middle ground here, where, you know, family understanding what it means to be a doctor, because if you have a family who doesn't understand that, it becomes very difficult. But at the same time, the doctor has to make the efforts as well. So there is a meeting in the middle, you know, in terms of shifting gears when you come home, you know, your mum or your dad or your partner, you know, doing the things that you and only you can do, and really showing up for those things when you can. Because
and also, I think having some friends that are medics, if you don't have a partner that is medical or interested in any of that, you know, every now and again, meeting up or doing Zoom meetings with medic mates, perhaps, like my dad's a surgeon, so we talk shop, you know, and the rest of my family are like, oh, you too.
Yeah.
You know, but we talk about interesting cases that he may have seen. You know, his special interest is oncology and gynecology, which fascinates me, you know, women's health and things like that. So we're always catching up with each other and you know, learning, I guess, from each other. And so if you haven't got that in a partner, maybe, you know, really make sure that you keep up with your medic friends. I do. I have a group of us that are always super happy to catch up. And, you know, we always end up talking about medicine somewhere in the evening. And that's nice to have that ability to vent and to talk, and, you know, to unravel some of those stresses that if you don't, they can be internalized quite significantly.
I mean, I'd say not even if you don't, you know, even if you do have a partner who's very understanding and you know, then you still need that community of doctors. There's a shared experience there, isn't there, that goes beyond anything else. I was, last year, start of the year, was at a funeral of a friend of mine from medical school, and really sad. He died on the floor in ICU, working, and we were afterwards at the pub together, and it just occurred to standing there with a group of doctors talking. And just it reminded me that feeling of safety that you have when you're surrounded by people who understand you, and because there is an element of no one else will understand you. Being a junior doctor, out of your depth, making decisions well beyond your pay grade, decisions that have good and bad consequences, and living with that, and all of that. That community of doctors is so powerful. To tap into beyond your work interactions.
Yes, it is.
So, Jo, if you could go back and give some advice to your 18-year-old self, the three best pieces of advice you could give yourself, what would they be?
Gosh. Well, I think to know your limits. I think as a doctor particularly, it's very important to be able to say, I don't know this, but someone else that I know might, and to know when you've got to go and find out and ask your peers and your consultants and your elders, because there's so much value in learning from the people above you. I think follow your dreams as well. I know medicine has a conventional way of unfolding a hierarchy. We do certain jobs, house jobs, and then we go on. But I think somewhere in there has to be passion and dreams. And if you haven't quite found it, move sideways. And like you said, even within medicine, you might find it. So I'm certainly glad that I've had the courage to follow my dreams. And I think the third thing is just kind of, fulfill your own personal health destiny, because I think if you do that, you become an inspiration for your patients, and you keep yourself kind of living a long, happy, healthy life, because health is everything.
That's right. Be a doctor who lives as an example, not a lesson.
Yeah, as much as you can, anyway.
As much as you can within what is a tough job. Absolutely.
Yeah.
And I guess just finally, how would you like to be remembered?
Ooh.
Big question, that one.
Oh gosh, it is. Well, I think definitely somebody who loved life, because I do, and dream big. I'm always teaching my children that. I always say, doesn't matter what you become, just love it. Just love it, get involved, put everything you have into it, and be happy. That's all you can do, I think.
Well, you might as well be. Jo, that's been fantastic. I've got a bunch of other questions I could ask, but for doctors are the audience, and anyone listening or watching is already almost given 45 minutes. So, look, I've really enjoyed it. I really enjoyed hearing your journey and what I guess the different mindset that said that caused you to explore other paths in medicine. And I think that's an important piece for people is, you don't have to get caught up in that. Here's the prescribed path that you must take. There are different ways you can be a doctor. There are different ways you can contribute. And I think, really for me as well, it's a great reminder that ultimately, all of this well-being piece comes down to prioritization. And not just having something as a priority, in your head, but actually living that prioritization as well. Because until we do that, we keep putting ourselves to the bottom of the pile. Our health suffers, our family's health suffers. But when we make real shifts in that prioritization, and to your example, it's not always easy. Selling the business is kind of a radical thing to have to do. But if you have to do it, you have to do it. And I think that's been a really great reminder for me as well. And I'm sure for any doctors listening. Are there any final things, to an audience of doctors that you'd like to say?
No, not really, other than that, to always remember there are options. You aren't stuck. If you're unhappy, explore. There's a whole world out there, and doctors have an incredible skill set. Most are incredibly articulate. We have a wonderful mindset, and there's a lot out there.
Thank you, Jo. You're a living example of that, living that passion as a doctor, and I've appreciated our conversation. So thank you.
Oh, thank you for having me. Take care.
You too.